Well, I started off my career actually as a researcher, and during that training process we were exposed to some clinical medicine because we ran a genetics clinic and physicians would come and see patients in that setting. And so that's when I first was exposed to clinical medicine. And there was a sort of excitement about that. There was a bit more of an impact that you could make like the day of an interaction as opposed to research, which can take a long time. And so that was really attractive to me. And then I found out that I could have a career in clinical medicine with a research component to it, so that's what got me excited and started in the first place. When I finished my training, I had met with several different hospitals that were interested in a pediatric ENT who also wanted to have a component of research. And I knew the chair of the department here and the chief of the service from other meetings before, and I knew that they had a robust research program here. What I didn't realize was what a great place to live it was. And so they invited me out for a visit. And when I came, I just fell in love with the place. It was very obvious that the people working here were extraordinarily happy. So one of our efforts here at Arkansas Children's is to discover on a molecular and genetic basis the cause of a lot of the diseases that we see as ENTs. And so my primary interest is looking at individual cells that grow in things like vascular anomalies, for example, and figuring out what's wrong with their genetics and what's wrong with their molecular biology that causes the disease in the first place. And that knowledge will help us develop new tools that may or may not involve surgery in the treatment of these diseases. I think my personal philosophy, and I know it's shared with my colleagues, is that we like to treat the children that come to see us like they're our own children. And so if you come to see me or come to see any of my partners, we'll listen to all of your concerns, and we have the expertise across the entire breadth of our department to address any number of illnesses that your child may have that may require something very simple or something extraordinarily complex.